Hello.
Hello.
Hi, my name is Ava, and I'm going to be doing your physical, a part of that today.
Okay.
Do you have any questions regards to me doing your physical?
No, I don't.
Okay, good. I'm going to start off looking at your identifiers,
Okay.
and I'm going to ask you, comparing with my medical record, your name and your date of birth.
It's Ashlyn Eubanks, 11488.
Okay, Ashlyn, can you tell me if you're allergic to anything?
I'm not allergic to anything.
Okay, good. So, first of all, I want to take your vital signs, and I will
Okay.
be omitting the temperature today, okay? We'll do that at another time.
Okay.
I'm going to ask you to raise up your sleeve
Okay.
so that I can get a blood pressure cuff around your arm.
All right.
Are you in any pain on a scale of 0 to 10?
No, I'm not.
That's not too tight, is it?
No, it's not.
It's 118 over 80. Is that about where you were at?
It is, yes.
Okay, now I'm going to assess your pulse rate, and I'm going to use your radial artery, okay?
Okay.
And that would be on the radial side of your thumb. Okay, Ashlyn, your radial pulse rate is 78. It is regular rate and rhythm, as well as identified your respirations during this time. And I noticed your chest rising and falling, which was what I was looking for with no labored breathing. And I got your respiration rate at 16. Okay? All right, so you said you wasn't in any pain. So now I'm going to look at your skin.
Okay.
Okay? And everything that I do, I'm going to do it bilaterally. For this assessment, I will just usually be doing one side, okay?
Okay.
And I'm going to start off and I'm going to look at your skin, and I'm looking for any lesions, any cuts, any ecchymosis, any rashes. And your skin looks fine. I do not see any abnormalities in that regard. It is warm, pink, or to the ethnicity appropriate. And it is dry and soft. Your capillary refill is less than 3. Okay. And I would again do this bilaterally, okay?
Okay.
I'm now going to put on some gloves, and I'm going to check your head and your scalp area. I'm also going to look at your shape of your head. It's well rounded, it's erect, and it's got good control. I do not see any abnormalities in the shape or the size. It is symmetrical. So I'm going to come over here and I'm going to get me a pair of gloves, okay? I'll be right back.
Okay.
So I notice that your hair is medium in length. It looks healthy, colored. It is very well distributed about the head, I would say medium texture. I'm just going to look at your scalp, and I'm looking to see if there's any excessive flakiness or oiliness, which I do not. Your scalp appears to be white, translucent. I do not see any lesions, any rashes. When I palpate, I do not feel any lumps, masses, anything that I would be concerned about. Are you having any issues with anything in regards to this area?
No, I'm not.
Okay, now Ashlyn, I'm so sorry. I'm going to palpate your tympanic artery,
Okay.
and here I am looking for my location to locate it, and it's usually going to be between your eyebrow and the top of your ear. And when I feel for your tympanic artery, I am looking to feel if it's palpable, and it is, and then what it feels like. And it should have an elastic feel. And yours does have a good elastic feel. And I feel no abnormalities as far as with the rhythm or the rate. Now I'm going to check for your sinuses. Have you been having any issue with your sinuses? Any pressure?
No.
Okay. I'm going to check your frontal and then your maxillary. Your frontal will be on the forehead, pressing using my thumbs. Any problems?
No.
And then your maxillary. Any problems there?
No.
I do not feel any tenderness. I do not feel any swelling or anything like that, and no tenderness noted upon palpation. Okay. What about your nose? Are you having any trouble smelling? Can you block one side and smell for me?
Yeah.
Okay. Okay, no problem.
No problem.
So now I'm going to do a smell test, and this would be cranial nerve number 1. And I'm going to look to see if you can, as you close your eyes, I'm going to put something in front of you, and I'm going to have you smell. Okay?
Okay.
So this is your olfactory cranial 1.
Alcohol.
Okay, very good. So cranial 1 would be intact. So next, Ashlyn, I am going to have you smile, frown, puff out your cheeks. Okay, so cranial nerve number 7 is intact with good facial expressions and movement.
Okay.
Okay, so next, Ashlyn, I am going to do a 6 cranial or 6 cardinal field of glaze with your eyes, and I'm going to use my pen light, and I'm going to have you follow my pen light, okay?
Okay.
I don't want you to move anything but just your eyes.
Okay.
And I'm going to place this about 12 to 14 inches from your nose, and then I'm going to have you follow it, and I'm going to move very slowly as I am looking for cranial nerves 3, 4, and 6, and I'm going to do the 6 areas. Back to the center, and left, and right. So again, the 6 cardinal fields would be up, down, left to right, moving in a slow fashion like I did, and that would identify that cranial nerves 3, 4, and 6 are intact.
Okay.
Next, I'm going to use my pen light, and I'm going to check your pupils, okay?
Okay.
And I'm just going to compare the size of that. And Ashley, I would say your pupils are about a size 6. And I would look at this bilaterally, and I want to make sure they're round and they're equal on both sides.
Okay.
And yours are round and they are equal. So now what I'm going to do is I'm going to look for your pupil reaction to light, and this is cranial nerve 3 as well.
Okay.
So I'm going to see how well your pupil reacts to the light. When I shine the light, it should constrict.
Okay.
And I'm going to come in from the side. and her pupil constricts very well. And I would do this bilaterally, and I would also notice as I brought the light in to shining on her pupil that the other eye at the same time was constricting as well. We would call that a consensual response, and you had that very well, okay? I'm going to also have you to check for accommodation, and I'm going to go in toward your nose with this at a slow pace. And I'm watching for accommodation to see if your pupils constrict when I move forward toward the nose, and it did. So I would identify your pupil assessment as pupils are equal, round, reactive to light with accommodation, and good consensual response. I also want to look at your conjunctiva and your sclera while we're doing the eyes and the external area. The conjunctiva is translucent and it's moist, and your sclera is white and smooth. The external part of the eye, which would be the lid that I would be looking at, is smooth. I see no lesions. I see no exudate or drainage. I see well-distributed eyelashes bilaterally and well-distributed eyebrows that are bilaterally. And its eyes are symmetrical to the face as well. So now I'm going to look at your nose, and I'm going to look at your external, and I'm going to look at the skin, and I see nothing around that I would be concerned about, no lesions, no drainage anywhere. So I'm going to look up your nose as well. Now, a lot of times we would use a scope to do this, but for today's assessment, we are just using a pen line, okay? And on the nose, I notice that there is pink mucosa. It's moist. I see no lesions, no drainage. And I see that she has no deviated septum. Very good. And then we done the smell test. Okay. So I would say that your nasal assessment is with no abnormalities and no breathing difficulties through the nasal passages. So now, Ashlyn, I'm going to look in your mouth. I want to start off looking at the lip area on the outside. Your lips are pink and they're moist. I do not see any cracking. I do not see any lesions. And then I want to look at your oral mucosa, okay? And your buccal mucosa. So it is pink, moist, just 32 teeth, pearly whites. I see no dental caries. Her tongue is smooth, no lesions noted. It's lightly pinkish. Her uvula is present. She does not have any tonsils, so I would grade this a 0. Can you stick your tongue out and say "ah"? Her uvula moves appropriately up and down when she says "ah." With a tongue depressor, she would have a gag reflex. Can you swallow? And her trachea is well midline as well, and she has a good gag reflex, which would be cranial nerves 9 and 10, which is what I was checking for. Okay. Now, can you move your tongue from left to right, up and down? Okay, and that would be cranial nerve number 12. Okay, so those cranial nerves 9, 10, and 12 are intact. So next, Ashlyn, I'm going to look at your ears, and I would do this bilaterally. I'm just going to check one. Okay. So I'm going to look externally and at the pinna, and it is soft and subtle. I see no lesions. I feel no lesions. I feel no abnormalities. I'm noticing the placement of the ear, and the top of the pinna should go to about the corner of the eye, which would be appropriate placement, and this is bilaterally. Now I'm going to look in your ear with just my pen light instead of an otoscope.
Okay.
And if I was looking at an otoscope, what I would be looking for is the tympanic membrane, and it should be pearly gray and translucent with no bulging or no drainage or exudate noted. But for this assessment, we will just be looking with our pen lights, okay? And holding the pen up a little bit, I'm able to get a better view, and I do not see anything that I would be concerned of, no wax buildup or anything like that. Are you having any difficulty with your ears, any drainage problem, anything like that?
No.
Okay. So what I'm going to do now is what we call the whisper test, and I'm going to stand behind you, and I'm going to have you cover one of your ears, and I'm going to say a 2-syllable word, and I'm going to have you repeat that to me, okay?
Okay.
All right.
Football.
Football. She was able to identify a 2-syllable word with covering one ear, so she has good audible hearing in the ear, and I would perform this test, of course, bilaterally. Next, I am going to look at your neck area, and I want to identify any abnormalities in this area, and I'm going to first look and make sure there's no lesions or anything like that first, as we've been doing all along, and I do not see anything, and I would look bilaterally for symmetric on both sides, and it is. I can identify that there is no swelling just by looking, but I will be palpating as well, and again on both sides. So I'm going to start off just palpating your lymph node, and I'll just go down the auricular area and then the subclavicular lymph node swelling. And we should not feel any lymph node edema, and I do not. Any problems or any pain when I palpate it?
No.
Okay. So next what I'm going to do is I'm going to palpate your carotid, and I would do this bilaterally as well. I'm just going to do one side. I'm not going to press too hard. It should be strong. Hers is strong. It should be a +2, which would identify it as strong. I feel no thrills, which I do not want to feel. And it is regular rate and rhythm. Okay, Ashlyn, the next thing I'm going to do, which is one of the last things, is we are going to check your range of motion of your neck. So I'm going to have you do a few things for me. I'm going to have you go side to side, very slowly, and then front to back as far as you can, and then gently around. I would identify Ashlyn's neck mobility with range of motion to be very in control and very good without any difficulty, crepitus, any cracking or anything like that noted. Okay? So Ashlyn, this concludes the criterion 1 through 11 of the physical assessment. Do you have any questions?
I do not.
All right. I appreciate you being our patient today. Thank you so much. I'm going to do my documentation and my findings.